Now for the cross-table lateral hip, this is for the patient that's not able to frog their leg out on our routine AP and frog leg lateral. So what we're going to do is shoot a cross-table lateral. You're going to bring the x-ray tube down beside the table, and then you're going to get a grid cassette, a 10 by 12, and place it on the opposite side of the patient. But first I'm going to prop the hip up, so I'm going to have the patient roll a little bit. Okay. And if a patient has a fractured hip, they're going to have a hard time rolling. So if they have a sheet underneath them, that'll help lift the patient up enough to slide that positioning sponge underneath. Okay, next palpate the crest. And you're going to have this very top edge into the crest. And then you're going to have the tube angled at an angle so that the front of the tube and the cassette are going to be parallel with each other, because you want to be careful to avoid grid cutoff. Okay. Next, in order to see this opposite hip, I'm going to bend this knee up and check and make sure that the central ray is hitting at a point where the leg comes to the pelvis or an inch or two below that. You'll be in the area of the neck of the hip at this point. So in order to be able to ensure that this leg does not get in the way, sometimes the patient, depending on their position, can hold their own leg up so that we can get the hip joint, or this may require a technologist putting on a lead apron or a family member putting on a lead apron and just holding the leg up so that we can cut across here without having this opposite leg in the way. Now, in the event that the patient has two fractures, they're not going to be able to lift up either of the legs. So you can use the method, the Clements-Nakayama method, in which it's very similar to this, except you're going to raise up the x-ray tube and then angle down approximately 15 degrees. And what this does is that it skims over this side so that we can get to the hip on the opposite side. Now, because we have used a 15-degree tube angle down, we want to have our grid to complement that. So you're going to angle your grid approximately 15 degrees so that our tube facing grid are going to be along the same plane. Make sure that your marker is in the light field. Okay, and so this is imaging of the hip whenever both of the hips are fractured. So you would have to do each side. On this one, we're just getting the left hip. For the right hip, you'd have to position the tube to the other side and then cut across this way. Okay, so just keep in mind the top of our IR is going to be at the same level as the crest. So the 10 by 12 image receptor, that midpoint will coincide with the same level as the neck of the femur.